Good afternoon, everyone. My name is Justin Furrow. I'm the chair of the Chamber's Public Policy Committee. We're here today to talk about COVID vaccines and how employers can deal with COVID vaccines, how they impact the workplace, and how we can implement return to work strategies as COVID vaccines become more widely available. I am joined today with a panel of experts. No, I'm not the expert, but I'm joined with a panel of experts from local practice one-to-one health. We have with us today Dr. David Bruce, Dr. Lisa Smith, and Dr. Keith Elton. Welcome, everyone.
Thank you.
Thank you. And thank you for being here. So these physicians, and I know them and know them well, have been very involved and active in the return to work process, really starting with the pandemic outbreak in March of 2020 and continuing to today, and helping employers implement effective mitigation and prevention strategies and then return to work. So Dr. Smith, you're highlighted on my screen right now. What would you say, as we're hopefully nearing, I don't know if we can say nearing the end, but nearing a turning point in the pandemic, what's the number one thing that employers need to consider with respect to the COVID vaccines right now as they're looking at returning to work and getting people back?
Well, I'll tell you, since vaccines are really the key to ending the pandemic and allowing us to provide safety for ourselves, our families, our workplace, the employers have a very special role in that it's nice to say it's a priority at your workplace. And if vaccination is a priority at your workplace, you would allow people to go ahead and get that vaccine. And in the rare instance where they really can't work the next day because of their symptoms, because you can have some flu-like symptoms after the vaccine, that's part of getting the vaccine, because we got to think about the future. The hardest thing to think about is not what's happening to me today. What's going to happen to me and my colleagues and my entire business tomorrow, next month, next winter? And if we think about how we're going to work together, then we have to do something about it now. And that would be to vaccinate and make it a priority.
So I should have said this when we started. We do have a Q&A function. So please, if you have questions, drop them in the Q&A. And also should note, those of you that have watched these webinars, I am an attorney, and but we're not dispensing legal advice today necessarily. We're talking about the medical aspects of the employment vaccine. And I will caution everyone, including our panelists, you all know, this topic touches a whole host of legal issues. And so it's been a really interesting opportunity to blend the legal and the medical with the practical. Dr. Helton, on that point, COVID vaccines, should companies require them for employees to return back to an on-site work environment?
I think requirement is a difficult topic from a legal perspective to cover. So I'll let you cover the legal aspect of that. I tend to be one of those physicians that believes you try to educate folks as much as possible, and employers can take a lead role in helping educate their employee base. This vaccine has created quite a bit of diversity in the way people receive information. Obviously, social media, the news channels, and unfortunately, it's put our population at kind of a divided state around the vaccine. But that's our job as clinicians, is to help educate people on the best clinical advice that we have. So certainly, employers may require, some may require their employees to be vaccinated, but others, I hope, are just continuously encouraging their folks and educating to the best possible ability.
Dr. Bruce, Dr. Help makes a good point about education programs. And I know as I've talked to clients, it's one of the main things I've focused on is really an education program and encouragement to employees. Where would you look to educate if you were trying to educate your workforce? Because as Dr. Helton mentioned, we see a lot of bad information out there. You seem to see the bad news and the one adverse event or adverse consequence. So where are you guys looking to, other than the one-to-one website, where are you guys pointing people to educate people about the COVID vaccine?
I think that's a great question. All of us are sick of this pandemic, and I think you touched on a great point. We've been told by the leaders, Fauci's told us that we should wear a mask. He told us early in the pandemic we shouldn't wear a mask. Now we're supposed to wear 3 masks. We're told that the vaccines have been around just a few months and that we shouldn't look at these. People have told us that. There are people spewing all kinds of things out there, and it's just like anything else. When there's a mixed message and there's not a concise message, because it is a novel virus, it's caused a lot of sides to form against each other. And as physicians, we have to go through all that stuff. And Lisa and I really work hard for the COVID task force, and we read PubMed. PubMed is basically a server that lists library sources of information as it comes out on all medical topics, orthopedic surgery, which is my specialty, pediatric surgery, which is Lisa's, and Keith goes to it for primary care. And so they're up to date, and we're delivering a concise message, but it's also fact-based, it's science-based, it's stuff that's been studied. And so as far as a resource for a person to go to, a lay person to go to, I do think that the CDC website offers a lot of information that's there. They're several months behind as far as the data that's coming out. We like to stay in front of it as we advise groups, especially manufacturing groups and other industries around the topic. But the CDC website is terrific as far as what it does. But you still have to go and look at the information that's there, because they'll supply the articles that support why they say to do a certain thing. And I think that's a great topic. And as far as the vaccine events and things that happen, there's this wonderful mechanism where the vaccine safe idea, where you can actually self-report any issues you've had with your vaccination. And that's done through VAERS. And so it's a vaccine adverse events site, and people self-report reactions they've had, things that have gone on to them. And that's how the Johnson & Johnson vaccine was picked up on, by the way. People are worried that we're going to get this vaccine and we don't know how it's going to work. Well, there can be some truth to that, but so there's a self-reporting mechanism, and the government, the FDA, was able to very quickly, 6 people had an issue with the Johnson & Johnson vaccine, a horrible issue with it. But quickly they put it on pause because they recognized from that self-reporting that there was an issue, and it allowed that mechanism to work, which is fantastic. And so we know with vaccines that you're going to have issues within the first 6 weeks. That's historic since the 50s when we really started doing modern vaccinations. And that the first 6 weeks really means everything with these vaccines. And so we were able to actually ferret out some issues, and I think it showed that it worked. But to answer the question in a very long way, the CDC website, I think, is a great place to go. But you really need to read through it to make sure that it's it, and realize that it's a whole document. People like to pick out certain parts of it and say that applies to me, and it doesn't work that way. It's a whole document. You have to read the whole thing and how it applies.
So Dr. Smith, Dr. Bruce just mentioned the controversial topic of masks. So let's talk about vaccination, COVID vaccines, and masks. If I've been vaccinated and I'm returning to work, is from a medical recommendation standpoint, are you recommending that individuals that have been vaccinated should still be wearing masks?
Well, you have hit the #1 controversial workplace topic on the head. And our initial advice, and the 3 of us agreed on this, when you have a mixed population at the workplace, you have some people vaccinated, some people vaccinated, but they've not passed their full period of immunization. You're not 2 weeks past that second dose or 2 weeks past your Johnson & Johnson. And then you have people who don't want to vaccinate. Everybody's at a different state. And so we were recommending that as we get together, we come back to work, we maybe are in a closed space, poorly ventilated, that everybody still needs to be masked. So what does a vaccinated person have to risk? We are starting to think that if you have a large enough viral load exposed to you, that maybe you're not going to be able to handle it. And so we're actually recommending that the masks don't come off until the incidence of the coronavirus in our community goes down. And we're nicely seeing it. It halved over the past week. It is going to be your non-vaccinated person that would potentially bring the virus into your workplace. with the potential for your vaccine, which is really, really good, but not perfect, to potentially put you at risk. So masks are still really important because we still have a very high, not extremely high, but very high incidence of coronavirus in our current community. And masks will work very good in a closed situation that's poorly ventilated. So we're still recommending them. And they're in place at the hospitals as well.
So Dr. Helton, Dr. Smith touched on mixed populations of vaccinated and unvaccinated people. What are you all recommending with respect to the mixing of the two? Do you believe employers should just only invite vaccinated people back, or allow them to mix and commingle, or how are you guys recommending that be handled?
Yeah, so that's the nice thing about mask, is if you have a mixed population, it's best to wear a mask. And so we encourage our employers, as well as all healthcare, to continue wearing masks. If you continue wearing masks, it's okay to have a mixed population as long as you're tracking folks if they get ill.
Have you seen anyone that any of your clients, employer clients, that are mandating the vaccine and are limiting the workplace to only those that have been vaccinated?
But we have a couple of clients that seem to be approaching it that way. They haven't yet, but they seem to be heading in that direction.
And are you having, you're really succinct in your answer, so I'm gonna make you ask more questions. Are you seeing anything switch? You know, my perception is we had a lot of people getting vaccinated as soon as they became available. And I think we're getting some headwinds now where you're seeing that reluctant population that maybe isn't going and getting vaccinated as much. Are you seeing employers starting to change their thinking with respect to mandatory versus encouraged vaccines?
Not on a large scale. We are seeing some small employers that are being very aggressive, but the larger employers, it's more difficult to mandate.
Hey, Justin, I'll say something to that too, because we are seeing a little bit of a switch toward people really wanting to push for vaccinations for normalcy. We're seeing that in our schools that we advise. We see that in the classrooms that we advise, because the goal for next fall is that we hopefully can have a full dense classroom with masks off. And the way to do that is with a high rate of vaccination and a low prevalence of the virus in the community. And so we are seeing a push, and the biggest holdback is people like you, the lawyers, are really debating the legality of those things and whether we can or we can't. But I'm seeing and Lisa can speak to that too, over the last 3 to 4 weeks, as we've seen some hesitancy in the vaccinations and the numbers are rolling down, all of a sudden people have got this fall thing in their mind, and they're really pushing towards thinking that we should be vaccinated. And I'll tell you something interesting, and I'm proud of this. I have in my practice, all of my employees have been vaccinated, every one of them. And so when the patients aren't in the office, we actually take our masks off and we dine together and we eat together. And I feel very comfortable about the fact that we're doing that. And I think if you get enough people vaccinated, we could still feel comfortable with that paradigm.
Dr. Bruce, you have a number, I've heard it referred to as herd immunity, and I think that's kind of what you're getting at in terms of your smaller employment population. So let's say my business is 85% vaccinated. Is that a high enough rate, or do you think it needs to be even higher?
Well, ideally, I would like everyone to be vaccinated, but there are religious reasons that people would not be vaccinated, and I respect that. There are certainly medical reasons, although there are only a few that I certainly respect. And in no way would I ever want someone to prove to me that they were vaccinated or anything like that. And if someone said I have religious reasons by which I don't want to be vaccinated, I certainly would never challenge that. I wouldn't even recommend challenging that. But if we can get above the 80% mark, I truly believe that we could probably take those masks off, is provided the prevalence isn't 100 per 100,000. If we're down in the below 10 per 100,000 rate of prevalence in the community, I think that would probably be safe, especially if you get down to 3 to 5% prevalence.
Yeah, and it's good. It sounds like, Dr. Bruce, you're a smart employer, because from a legal perspective, you have to give credence to those religious objections, and you have to give credence as well to the medical, the disability related or pregnancy related exceptions. And we could go another hour on the legal topic, but just to say employers can require COVID vaccines. It's a very nuanced and tricky and thorny issue. You can require them, you can incentivize them, but you really have to approach that thoughtfully and with effective and competent legal counsel right by your side. But yeah, it can be mandated. Dr. Smith, on with respect to return to work specifically, okay, we've talked about masks and we've talked about vaccinations. Kind of give me some of your top 3 list of things that you're advising employers on, or telling employers they need to think about as, you know, they've been sitting at home for 13 months now and they're bringing people back into the workplace. And how are we planning that?
Justin, first, and it actually is the answer to this question, is that I don't want you to think that your herd in your office is where you have to achieve herd immunity. I think when I talk with folks who are running businesses, that's their biggest mistake. They want to know if my little 85% in my office that I have vaccinated qualifies.
Mm-hmm.
And your office is not a bubble. And so while you need to do the best to get your circle of people vaccinated, you're not going to achieve what's considered herd immunity in your group, in your office. So I would advise first employers, while you want to encourage the majority, everyone who can be vaccinated, to get vaccinated, to protect your business, to keep everyone working, you can't look at a number and aim for that within your company. That's the number within our community.
Okay.
Granted, a lot of people say that's the number within our world. We're not protected and safe until everyone is safe, but certainly your region is very important. So you kind of get into the weeds of epidemiology at that point. But I don't want you to think you have a number you have to aim for at work. You just want to get everybody. And that's why I encourage employers to actually look at a normalized number for how much coronavirus is circulating in your community. That New York Times tracker normalizes all of our cities to cases per 100,000 individuals and assigns a risk level. That extremely high risk, we were at it last week, but we've halved that and now we're at high risk here. And we'd like everyone to get down to at least a medium risk, so that 1 to 3 out of 100,000 people are the people with active coronavirus infections. That's a pretty low rate. And that's probably where we'll kind of roll around here as we go through the rest of the summer. We really don't think it's going away. The second thing we want employers to remember as we go back to work is we had a tremendously low amount of all the other diseases. And that happened because we weren't being germy. There are other germs. We still want to take the lessons we've learned with coronavirus hygiene and keep up our hygiene. We should wash our hands when we come to work. We should wash our hands before we go home. We should wash our hands before and after we eat and keep our surfaces clean. We don't want to think that because coronavirus is gone, we don't have to clean everything. We don't have to have a hygiene theater and spray everything down, but we should be attentive to general hygiene. And then finally, I would say the third thing to think about as everyone comes back to work is what the ventilation status of your workplace is, that your HVAC is working, you have maximal air exchange going on, and all those other sort of respiratory illnesses benefit from this as well, or else really not getting those respiratory illnesses, because it's very evident now that ventilation of the closed spaces made a big difference for us.
Hey,
Dr.
Justin,
Hill? Yes.
that point she made about herd immunity is so important for everybody to understand. There's this thing called R naught, and basically what that is if one individual has a virus or some disease, how many people potentially can they infect on average? You know, one person could infect 80 or 120, but on average, how many? And so R naught was thought early without mitigation for SARS-CoV-2 was around 3. And so that drives the pandemic. One person infected 3 more, then they infect, 9, and then just, balloons from there. So the concept of herd immunity is where you reach a point where that R naught is below 1. So for every one person infected, they don't infect more than one person. So if you can drive it below that level, then all of a sudden the virus drives out and it dies out because of it. And so that's where that concept, and we do confuse that with the workplace. But when we're talking about a safe workplace and not hopefully giving an unvaccinated person disease or spreading it further in the population, it is our feeling, but it is truly just a feeling that about 80% or above would effectively do that.
That's a good clarification. Dr. Helton, in terms of motivators, right? Let's say I'm an employer that's not going to require it, but I want to motivate my employees to get it. I want to incentivize them. What are some of the best methods you've seen that some of your folks or people that you've heard about have used to incentivize or encourage employees to get the vaccine?
Yeah, I think the most effective I've seen is a financial incentive, one-time financial incentive towards the employee for getting the vaccine. It seems to have been very effective, at least with the group that we actually did for that employer. It got tremendous buy-in. So a one-off financial incentive is probably the most effective.
You know, on that point, I saw a study, it's a month or two old now, but they tiered down and they asked a group of people, how much money would it take for you to get a COVID vaccine? It was early days of the vaccine. They started at, $2,000, $1,000, whatever, went down. And I think it was at least 35-ish% of employees would be willing to get the vaccine for as little as $100. Pretty small amount. So I think you're right. Everybody likes money.
And and just to follow, that's true with all wellness planning too. The small financial incentives mean a whole lot to folks that are hourly employees or lower wage. So,
and just a little plug for the employment lawyers in the room. When you incentivize this type of behavior, you have to worry about, again, your ADA implications and wellness programs and the like, and it's a little bit tricky. So don't just run out and encourage everybody to do it and offer money. You need to talk with your counsel about whether you're doing that in an appropriate way and building in the safeguards for accommodations and the like. Dr. Helton, I'm going to stay with you. Got our first question from an anonymous attendee, and I'm just going to read it. Even with the current vaccines only having partial FDA authorization through the emergency use agreement, why can't and why shouldn't healthcare provider employers like yourselves, in particular, those providing services to the people that are most at risk, like elderly and underlying conditions and all that stuff, why shouldn't those employers be able to mandate full vaccination of its workers? This person thinks to put those workers and the patients and clients at profound risk is unconscionable.
Well, we have the same restrictions as any other employer. Our staff has religious reasons or medical reasons that they can't get the vaccine. So mandating vaccines within our community, within our employees, even in healthcare, has the same challenges. I will say that we are fairly a lot more aggressive in how we educate and encourage.
So, Dr. Bruce, in terms of, so my people are back, you have a mixed population and somebody tests positive for COVID. What do we do with respect to quarantine and contact tracing and the like in a mixed population like that?
That's a great question. I do want to address that. The first healthcare system to mandate vaccination is the Methodist system in Houston, Texas. It's a very large system, and they've mandated vaccination by June 1 for all employees, administrators, anyone that works in the hospital to SARS-CoV-2. And that's a good question because there are some benefits to vaccination, and we deal with this in the school system as well. And for those people that think that it wanes at 3 months, it doesn't. The 6-month data on the mRNA vaccines is that the T-cell immunity is almost 100%, if not actually it is 100%. And so we've actually opened up that time period that if you've had an exposure pre-vaccination, everybody knows that if you had a significant exposure, you had to quarantine for 14 days. So now if you're post-vaccination, you're 2 weeks post-vaccination, and you've had an exposure at work, you no longer have to quarantine. You do have to monitor for symptoms, and if you do have symptoms, then you should back away from work and be tested. But if you've not been vaccinated, then you're going to follow the same old protocol that we followed all the way up until November when we got vaccines, in that you would have to self-quarantine at home and not work or work remotely. And you would have to go through some testing for most facilities to return, whereas that same paradigm would not apply to the vaccinated.
So either Dr. Helton or Dr. Smith. Dr. Smith's gone off video, so I'll throw it open to either one of you. So I've invited my people back, and let's say I have some employees that are worried or concerned about being in a mixed population. How should I respond to those worries or concerns?
Lisa, you want that or me?
She's actually on call right now, so I'm sure she's answering an ER call. That's on you, Keith.
No, great. Well, you should, once again, mask. Masking the population helps really prevent the spread of COVID. So that is the most effective way of calming any fears associated with it, is by everyone wearing a mask.
In terms
if
of,
you look
Go ahead,
at the
Dr.
hospital population of people who work in healthcare and are exposed every day, one of the things I laughed about some of these check-in things, have you been exposed to COVID-19 in the last 48 hours? Well, yes, I work in the hospital. I've been exposed every time I walked in that door. I was exposed to it. But if you look at the population, those people that actually know how to wear a well-fitted mask and not touch their face, the masks work very well. We did not transmit anywhere near the rate that the population as a whole transmitted the disease, and the contact tracing proved that. And so it's important to realize that masks do work, but you have to wear them properly. But you have to, as Keith was saying, that the mixed population mask wearing is going to be important for those people while the prevalence is high.
So, and this is a bit of an unfair question, so I'll open up to either of you that wants to answer. So with the current trajectory, assuming no major unexpected outbreaks, where do we see the COVID prevalence falling to a level where we can get rid of masks? What's your timeline looking like, particularly in the Chattanooga-Hamilton County region?
Well, in an enclosed space or outdoors? Outdoors, I just disagree totally. The virus dies in 16 seconds in the air in UV light. And outdoors, I really do not believe we need to be masking. Now, if we're at Neyland Stadium and 110,000 people crammed in there right now, where it is, certainly you should be masked. But, we go to lacrosse games and things like that. Soccer's going on right now. My wife and I are in the stands, and we take our masks off. I mean, we're not elbows to elbows with other people. So in those situations, I don't feel like you should be masked, even as we are. And I believe right now it's at 12 or 17. It's 12 per 100,000, I think, is what it is in this area. But my feeling is probably in the 3 to 5% range indoors. Once we get to the prevalence of 3 to 5% indoors, Lisa is more on the 1 to 3% range, but I feel more in the 3 to 5. And it's because we really don't know, and it is truly an educated guess.
Well, so we've been at this about 30 minutes, and I think you all have answered my questions more than capably. I'll just open the floor up for you to provide any closing comments and hit some return to work points or COVID vaccine points that I'm as my legal mind's not smart enough to ask you about. But I do want to thank, I know you guys were heavily involved in the COVID task force, the governmental task force. So I want to thank you for all that you're doing. So give us some closing comments about things we should think about. Tell us where on your website we can go for return to work strategies, or how we get in touch with you if we have questions that we just can't answer.
Yeah, I want to start and thank you, Justin. Thanks for the chamber for this meeting. The reason we're continuing to really encourage vaccines is to get to that herd immunity of 80% or more. Because the longer we wait to get there, the more we have chances of variants coming back around. And we may see a lull this summer where it drops down low because we're all more outside. But if our vaccination rate isn't really boosted up by next fall, we're all concerned that we're going to see a larger uptick in more variant cases that potentially could be more deadly in the fall and in the winter, and not gain the ground that we think we have. everybody's just wanting it to be over, and we haven't made all the steps to help it be over, particularly with the vaccine.
Dr. Smith, what about you? Closing comments or things you'd like to add that I wasn't bright enough to ask about?
I think you're not bright enough to ask about. I just think that everybody has kind of a different viewpoint. And, as far as the pandemic goes, going back to work means simplifying your cleaning spaces, but maintaining those good hygiene practices, making sure you have good ventilation, and making sure that you get vaccinated that you have the opportunity now. And if you're someone who is unsure, people like myself, like David, like Keith, like your personal physician, we've got answers for your questions, and we're readily available to answer them. Additionally, the one-to-one website has our latest newsletters at the bottom of the COVID services page, and our consulting service is glad to provide that information up on our website so that recent topics as well as questions about the vaccines are readily available. And all the previous issues are on Facebook pages as the one-to-one site. And we just want that information out there for you, for everyone to get back to work. It's time to get back to work. It's time to get our clothes out of the closet and shake them out and get the dust off them and just get back to where we need to be, which is back together.
And that website for everyone, and I'm gonna let Dr. Bruce finish, is the numbers 121.health, 121.health. It's a great resource for everybody in the community, and thank you for all you're doing on that. Dr. Bruce, how about you close us out?
Justin, I really appreciate the time. And I'll tell you, Lisa and I walk around the city. We like to walk a lot. And we look back and we look at the skyline and how much we love this city, how cool it is that we live where we do, and we love Chattanooga. And I appreciate everything that the chamber does. And I appreciate this opportunity. The couple of things, the mRNA vaccines, I feel very strongly, these are probably the safest, best vaccines that we have ever created. We started making true vaccines in the 50s. And what's neat about this, all the other vaccines before targeted the whole virus. This mRNA vaccine that we currently have targets just a spike protein, just part of it. And so it doesn't carry all that other baggage that's there. And despite what you've heard, the first time it was used was 1998. It was used for cell-targeted therapy for cancer treatment. It was used for Zika, Ebola. It's been used for MERS and SARS-1. And it was highly effective for those. And all they needed to know was the sequence of the spike protein to make it. The efficacy is unbelievable. And it's the first time in vaccine history that the effectiveness, what we were actually seeing with all the people that actually got it, is actually better than the efficacy that the trial showed, which is fantastic. And it's really unbelievable. It's a milestone. And there will be Nobel Prizes won for the work that these people did. There are 3 real key people that did it. And I encourage people to think about it really and look into the true articles around these vaccines and what they mean, because I do think it's a game changer, and I do think it will save lives, and I believe it already has.
Thank you, Dr. Bruce. Thank you, Dr. Held and Dr. Smith, the professionals from One-to-One Health. Glad to have you today. I feel like we got some really good information as employers are navigating these waters. Thanks to everybody who joined. And stay tuned, because the chamber's been really active in these webinars and educational series for the community and for our members. So stay tuned for the next one, and thank you all for being here today.
Thank you.
Thank you.